Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Canadian tobacco control officials may be learning a key economics lesson the hard way. When you make safer nicotine products less appealing and more costly, you push people back to smoking. It's called the substitution effect, and new research shows that provincial flavor bans on nicotine vaping products are doing exactly that, increasing smoking by nearly 10%. Joining us today to talk about the impact of Canada's flavor bans is Dr. Michael Pesko. Dr. Pesko is the J. Rhodes Foster Professor of Economics in the Department of Economics at the University of Missouri. He has published over 90 peer-reviewed papers, including more than 25 on e-cigarette policy. He is the director of the Tobacco Online Policy Seminar. He is also the director of the Social Impact Lab, a multidisciplinary research community dedicated to turning innovative ideas into rigorous research that improves public health. Dr. Pesko also served previously on the Canadian Advisory Board on vaping products. Dr. Pesko, it's great to see you. Thanks for coming back on the show.
Thank you for having me.
Previously on RegWatch, you've shared research showing that in the United States, policies like higher taxes on nicotine vaping products and flavor restrictions were associated with increases in smoking, affecting millions of people. For viewers who may not be familiar with your work, give us a brief snapshot of the type of research you do.
So I'm an economist, and I've been interested in the tobacco marketplace in particular. I've done around 30 kind of quasi-experimental studies of e-cigarette policy evaluations, mostly in the United States, but more recently now in Canada as well. Kind of the first wave of e-cigarette regulation that was adopted in the United States was e-cigarette minimum legal sales age laws. Second wave regulations included indoor vaping restrictions. It included e-cigarette taxation. More recently, we have a lot of work on flavor restrictions, right? And so the general kind of setup, right, is with federalism in the United States, different states are adopting different policies at different points in time, right? And so we have the nice ability to use secondary data from sales data or survey data sources, for example, to study within a specific state that adopts the policy. We can see a pre-period and a post-period, and we can compare that state to other states that don't adopt the policy, right? So that's been basically the setup. We call that difference in difference modeling, that we've looked at a variety of different policies then using this, right? In general, we find that the policies, they reduce e-cigarette use, right? But they also have harmful substitution effects to combustible tobacco use within a whole host of different populations. We've documented these effects among kids, among young adults, pregnant women, and within sales data, for example. So that's my work in a nutshell.
How difficult is that to parse between what may be an intended result or an unintended result?
It's difficult in the sense that you don't know really, you never are fully know why policymakers do what they do, right? I mean, sometimes they will say certain things, right, that appeal to, their voters. But in reality, could there be something going on behind the curtain, right? That causes them to act in ways that they do. So in that sense, what is intention, right? Like, we never have full information, on what policymakers intend exactly, right? But we can try to, infer what intention is. A lot of policymakers at least talk about the benefits of reducing e-cigarette use within a youth population, right? I guess I don't have any real reason to doubt that is one of the factors that is contributing to e-cigarette policy changes, right? And so we can indeed study it. Then if provinces or if states adopt, a policy on e-cigarettes, we can study the effect of that compared to places that did not adopt to make some kind of statement about did this work in that narrow sense of what was intended for youth vaping, for example, right? But of course, then this policy could have effects in other marketplaces as well that were not intended, right? And that maybe are public health deteriorating, right? And so it's equally as important to quantify those effects as well as to have kind of a more holistic evaluation of the costs and benefits of a particular policy.
You've got obviously some experience and understanding of the Canadian landscape, don't you?
Yeah, I've done a few research papers now, on Canada. So I'm learning. It's federalism, right? I mean, is present in the United States, in which we have different states adopting different policies, and that really lends itself well to this kind of quasi-experimental approach, right? In which we have some places that have a policy, some places that don't. We have a pre-period, we have a post-period, and similarly in Canada, my understanding is it's the same, right? In that the provinces have a lot of discretion to enact different policies. So in that sense, there's quite a few parallels, I think, between the work that we would do in the United States and the work that we would do in Canada. I've also been a former member of the Canadian Advisory Board of Vaping Products, and that was really useful to kind of get more of a feeling for the unique issues that Canada is facing, the unique policies that are being considered. That's been useful to generate some kind of content knowledge about Canada that's specific to Canada.
Dr. Pesko, you're a co-author with Brad Davis and Abigail Friedman on a recent paper titled Restricting Sales of Flavored Nicotine Vaping Products, Effects on Nicotine Vaping Product and Cigarette Sales in Canada. What question were you trying to answer with this research?
Well, we were interested in what effect do the provincial flavor restrictions have, right, on both in terms of intended effects and in terms of unintended effects. So we used sales data that was provided by Health Canada, right, and we had data on retailers, gas and convenience stores, and their e-cigarette sales volume, right? So this is UPC level information, so we can distinguish between flavored e-cigarettes, non-flavored e-cigarettes. We know the province or the territory where these sales occurred, we can then kind of study using a pre-post design for control units and treated units, what effect that the policy had. And so, it had an overall 30% reduction in e-cigarette sales we identified. Then we were also interested then in, so that's potentially an intended effect of the policy, right? We're also interested in, some of the maybe unintended effects, right? And, one of the reasons that the e-cigarette sales volume reductions weren't larger, right, is there was a large substitution towards non-flavored and non-flavored e-cigarettes. And so we documented that, right? But among the flavored e-cigarettes, that sales volume fell to nearly 100%, at least within these particular stores that we're looking at, right? But the reason the e-cigarette sales volume overall only fell 30% was because of large substitution towards the unflavored e-cigarettes. We also were interested in the cigarette marketplace, right? And for this, we had shipment data that needs to be reported to the government. So we have potentially better data, I guess, on cigarette sales volume that's collected by government. And there we find about a 10% increase in cigarette sales once these provinces adopt these e-cigarette flavor restrictions, right? So that's clearly an unintended effect, right? And it could suggest that maybe cigarette sales declines would have been greater had it not been for provinces adopting e-cigarette flavor restrictions and reducing that as a substitution pathway. And then the e-cigarette data that we had was specific to gas and convenience stores, right? So that's limited, right? We would like to know something about what's going on in vape shops, et cetera.
So you also looked at Google Trends. You did an analysis there.
Yes, the point of that was to try to look beyond just the gas and convenience store data that we had for e-cigarette sales. And so we were interested, for example, if they purchase e-cigarettes more online in response to these flavor restrictions, possibly as a way to try to circumvent the flavor restrictions, right? Or if they search for vape shops more in Google, right? So we were able to download, province level panel data on vape shop purchases, on e-cigarette shopping, and we didn't find evidence of increases there, right? So there wasn't evidence of obvious substitution towards those channels. So it does seem like, the policy did reduce e-cigarette sales. Like we don't see evidence that it just pushed people from convenience stores to other markets to buy their e-cigarettes. It seems like in the data that we had, e-cigarette sales volume does decline, right? And so, that it's possibly not, it makes sense in that sense. I think that we would see this larger effect in the cigarette marketplace, right? Because people didn't have a way around the policy, it didn't seem, at least as far as we could tell.
Now, for the Canadian study, what provinces were considered or part of the sample?
We used all data at some point, at least, right? We were looking at flavored restrictions that were in effect as of June of 2023, right? That just when we did the analysis, and I think that also that takes us to the end of the e-cigarette sales data that we have available through Nielsen. And so there were some provinces that I believe adopted flavor restrictions after, and those would be treated just as control provinces in our particular study because they did not have the policy in place. But as of June 2023, there were 6 provinces that adopted flavor restrictions, right? That includes Nova Scotia, New Brunswick, Prince Edward Island, Ontario, British Columbia, and Saskatchewan. And then the other provinces and territories are treated as control units in most of our specifications. In some specifications, we dropped the lowest populated provinces and territories, but that didn't seem to affect our analysis at all.
Right. So Quebec happened after, and Quebec was the nuclear bomb in Canada.
That's right. It happened after.
So you mentioned unflavored vaping products. There was a move to those. For our audience, just kind of be clear about that. Those are tobacco flavored, but they're just classified as unflavored?
That's correct. When I say unflavored, I'm using that as shorthand to mean tobacco flavor or no flavors.
Just to be really clean here, what we're seeing is that flavor restrictions go into effect into a province in Canada. We see a 30% reduction in e-cigarette use, so vaping product purchases, and we see a 10% increase in cigarette sales in that province.
These are averaged across provinces, right? So but the average effect, right, is of a flavor restriction in a given province is a 30% reduction in e-cigarette sales and a 10% increase in cigarette sales.
That can't be a good result.
The volume of e-cigarette reduction is larger, right? But I guess if we believe e-cigarettes to have less than 1/3 the risk of cigarettes, right? Then the substitution would be detrimental to public health because you're trading off a 30% reduction in e-cigarette sales for a 10% increase in cigarette sales, right? So it seems to me unlikely to be, it seems to me like it's likely to be detrimental from a public health standpoint.
Yeah, that brings me to my question is, do you think they simply stop vaping, which I guess some do, or some of that 30% reduction, actually a reduction in the legal vaping products in that province? And could there be substitution into the black market?
Well, we try to look at that to some extent, right? With I don't know if it's the black market, right? But we try to use the Google data, e-cigarette shopping cart, right? Like what gets populated if people do that, right? Are these black market e-cigarettes? Quite possibly, right? I mean, vape shops, obviously, that's not black market, right? So we do a separate query of that and don't find evidence of increases, right? Um, um, so, we don't, it seems to, from as far as we can see, that this was a actual reduction, right? And I've done some other work on nicotine concentration restrictions in different provinces at different times. And that one, the findings were a little bit different, right? We found the reduction in e-cigarette sales volume that we see in gas and convenience stores, same as we see with the flavor restrictions, right? But within the Google search, we saw increases there, right? And so we really thought like, hey, the net impact of these restrictions on e-cigarettes due to this particular policy, nicotine concentration restrictions, ambiguous, right? And maybe not surprising, when we looked at the cigarette market, we didn't find any evidence of effects in the cigarette market, right? Possibly because there was nothing going on in the e-cigarette market. You just had people substituting from one source of e-cigarettes to another, right? Within the flavor restriction, it does seem like across the board, there's not evidence of increases, at least within the ways that we've looked at it, right? And then, possibly as a result of that, reduction in e-cigarette sales volume, we see the increase in cigarette sales volume.
Now, is that something as an economist you would expect to see?
I mean, it depends on what the economic relationship is between cigarettes and e-cigarettes, right? It's not obvious that not every product is an economic substitute, right? So it depends on if there's one product that people use, and then because of that they're more likely to use another product, right? Like that would be like an example of an economic complement relationship, right? Like for example, golf clubs and golf balls, right? Like if people buy more golf clubs, they're probably also going to buy more golf balls, right? So that's an example of a complement, right? And so it just depends on, is it a complementary relationship or a substitutionary relationship, right? So, but then within what we see, right? So, I mean, a lot of economists have been interested in this question, right? I've done a lot of papers looking at this using a variety of different policies in the United States, from minimum legal purchase age laws, e-cigarette taxation. Flavor restrictions is kind of a newer policy that people are interested in. Almost almost universally, the results suggest substitution, right? There's a few outliers that suggest the opposite. I was a part of a systematic review with people at Cochrane, and we looked at all these quasi-experimental studies, right? And we also concluded that there's evidence of the products being substitutes based on what we see. So the evidence base is pretty clear that these products are substitutes, and therefore it's not surprising that what we've seen in other studies, that relationship is present in Canada as well.
And I think the surprise, maybe for some, maybe not, but the concern certainly is that while nicotine vaping products are clearly a substitute for combustible tobacco products, but we're seeing here that the substitution effect goes both ways.
Yeah, there's symmetrical effects. It doesn't need to be that way, but yeah, most of the work suggests that that's the case. I mean, if you raise e-cigarette taxes, you increase cigarette consumption. If you raise cigarette taxes, the same, you increase e-cigarette consumption, right? And so I don't think that's really like surprising, right? If you accept that they're substitutes, that either tax would push sales of the other product, right? I think, the way that policymakers, I mean, from a public health perspective, then I guess in that context, what makes sense is to try to increase regulation on the most harmful product the most, right? To take it, if the substitution is going to happen, right? Let's try to take advantage of that, and let's try to move people down the continuum of risk, so that they end up in a place where they're doing the least harm to themselves and to others.
One's more harmful than the other. So is there then something inherently wrong about flavor restrictions on e-cigarettes? Because if the effect is that they increase smoking, that might not be such a good thing.
I mean, inherently wrong if that feels so little normative, right? The uh, I think that like if a government is thinking about like if their objective is to um, maximize public health, right? They're interested in doing something on tobacco. Um, I think that the optimal place to put regulation is on combustible products, right? So I believe that menthol is already cigarettes and cigars are already menthol is already banned in Canada, right? So that's different than the United States, right? Where that still is actually a realistic alternative policy. Like let's get tougher in terms of flavors on combustible tobacco. Um, um, and that makes a lot more sense to me in the United States than to ban flavors in e-cigarettes, right? Including in some cases, you cannot buy flavors in e-cigarettes that are available in combustible tobacco in the United States, right? Pretty wild, right? But maybe there's other policies. So even if flavors are already there's not any kind of potential to be more harsh in the combustible market in Canada. Maybe raising cigarette taxes, right? Further, right? Anything. It's better to try to if policymakers are intent on doing something about tobacco, just encouraging them to focus on combustible products, right? Like that's really where the public health gains are, and continue to increase the distance between the regulation on combustible tobacco and vaping products, right? That's a good way to maximize public health.
That's an interesting way to put it, increasing the distance between the policy interventions and so forth between combustible and vaping nicotine products. But let me ask you, is that what we're seeing? And you can combine this with both Canada and the U.S. if you want, because it seems to be a lot of the same actions, is that they're raising taxes, they're putting in restrictions. I don't want to, push you into a political comment, but from a public health perspective, is that actually increasing the distance between the two different products?
Well, if you're regulating e-cigarettes, then no, right? I'm not entirely sure in everything going on in Canada at the moment, right? So I'm hesitant to comment about Canada specifically, right? Just continuing to increase regulation on combustible tobacco, not enacting new regulation on e-cigarettes, right? I think that will have benefit from a public health perspective. And also, if another objective that governments might be trying to maximize, right, that they maybe are a little bit less, they're more hesitant to state, right? So this is where what do policymakers intend is a little ambiguous, right? But revenue is certainly something that is a consideration, even if it's not something that policymakers want to talk about, right? But if that is kind of the hidden objective, right, the cigarette marketplace has a lot more revenue potential, right? So if you were going to enact a tax, for example, the e-cigarette market's quite small compared to the cigarette market, right? It's not going to generate very much revenue. But if you increase that tax by a fraction of what you're considering for the e-cigarette tax and apply that to the combustible market, that's likely to generate more revenue and also likely to do more public health good, right? By encouraging substitution towards the less harmful products.
Should these results be of any surprise to tobacco control officials in Canada?
I don't think that they should be a surprise. The evidence up to the point at which these policies were being adopted for people that are paying close attention, right, is that these are economic substitutes, right? If you believe that you can learn something about e-cigarette taxation in the United States and what that underlying relationship is between e-cigarettes and cigarettes, and that would probably hold in Canada, then you shouldn't be surprised, right? If you adopt a different policy, flavor restrictions there, and you see substitution happening.
You mentioned taxes. I'd like to ask you about excise taxes specifically because many provinces in Canada, including Ontario, which is our largest province, have joined the coordinated federal tax regime, resulting in excise tax increases of roughly 124% by the end of 2024. So the effective tax burden on vaping now approaches that of cigarettes. So from an economic standpoint, how does that kind of tax shock interact with substitution effects that you've studied?
If you want to kind of maximize, public health, right? One way you could think about where should we set taxes, right, is you could try to figure out, well, what's the relative risk of e-cigarettes compared to cigarettes, right? And let's say, the different estimates have been floated around, right? I've heard, 33%, I've heard 5%, right? Maybe somewhere in between there. I think that would probably be in the consensus of most experts, right? Somewhere between that range. So you could think then the optimal e-cigarette tax then should be between 5 to 33% of the cigarette tax, right? If we're trying to regulate proportionate to risk, right? So if Ontario does have a tax, the e-cigarette tax equal to their cigarette tax, right? That seems like a real missed public health opportunity, right? To try to encourage people to move down the continuum of risk. And there's no incentive at that point for people to switch from cigarettes to e-cigarettes. And in reality, provinces may benefit from allowing creating a financial incentive for people to switch to lower risk products.
In your research, do you see evidence that illicit or unregulated markets step in to service demand when legal flavored vaping products are restricted or priced out of the market?
It's hard to see illicit activity, right, within the data that we regularly, use, right, in economics, right. Survey data on use, like we don't really know where people are getting their e-cigarettes, right? I think the closest that data that we have to studying that illicit market, right, might come from Google Trends data, right, and particularly the e-cigarette shopping feature, because that could include illicit, products, right? And so we do see some evidence from nicotine concentration restrictions, at least that those purchases increase in response to nicotine concentration restrictions at the provincial level.
Dr. Pesko, I want to share with you and our audience a troubling video out of Ontario where multiple vape shops have been targeted by arson or attempted arson, with at least 5 incidents in just the last 3 months, and with 2 arsons occurring just minutes apart in the early morning hours at separate vape shops. You can see here this person breaks into this shop, pours gasoline all over the place, then dips out and tosses some flash paper in, and whoop, it goes up in flames. What do you make of that?
I think that there is unambiguously, like when there's tobacco regulation, there's going to be some kind of market response, right, to try to avoid that regulation. And that includes organized smuggling, right? It could include crime, right? So that's going to happen, right? I think what's maybe debatable is the magnitude of that effect, right? And I think there's a real opportunity for researchers to try to look at this more, right? And the relationship between tobacco policy and crime, right? I think is an underexplored area of work. If anybody wants to say that it doesn't happen, like that's that kind of defies economic rationality in my sense, right? I think what's debatable is the magnitude, right, of the crime effect. And I think we can have a reasonable discussion around, do the public health benefits of tobacco regulation outweigh the public health costs of extra crime, right, due to the regulation, right? I think that's a reasonable question. But I think I don't think we can pretend like that there isn't going to be some kind of a market response.
Shop owners and police emphasize that these were planned attacks, not vandalism or accidents. And vape shop owners publicly state they believe the attacks are tied to organized crime and the illicit vape market. So basically, I mean, if you're going to tax e-cigarettes to the point where they're a valuable product and organized crime can make money off of them, does that not contribute to seeing this kind of activity?
It seems like it absolutely would, right? Yeah, if you raise taxes, you increase incentives for organized crime to be involved.
Dr. Pesko, I've purposely left the discussion about youth vaping to the end. And as we all know, these interventions, the restrictions and taxes are all designed to prevent youth use. But do they also have a deleterious effect on adult well-being?
I guess I would suspect that it's probably most of what we're observing in this market is the effects among adults, right? At least because I think adults are more likely probably to source their e-cigarettes from gas and convenience stores, but I'm not sure. I mean, kids have to get them from somewhere, right? So maybe, there's a straw purchaser buying in these places that then distributes it to kids. Maybe kids buy in these places with fake IDs, right? I'm not entirely sure if the relationship would be that different from between kids and adults. So there's substitution happening, and I would say that it's likely to be happening among both groups, both among kids and adults. So yes, adults are being probably adversely affected by this, and I would say kids as well, and are also probably smoking more cigarettes than they would otherwise as a result of the policy. I guess I have a hard time believing that anybody that uses an e-cigarette that they're going to start smoking newly, right, in response to the policy. But I do think, though, that there are a sizable number of teens that were already using combustible tobacco, and that's really the margin that these policies are influencing. Do you want those teens to continue smoking, or do you want them to reduce their risk just like you want adults to reduce their risk?
During your time then, when you were working with the Scientific Advisory Board, sharing evidence with Health Canada, were any of these potential outcomes, kind of known or discussed when it comes to, say, like the taxes and the flavor bans?
Yes. Yeah. I mean, people would raise, and myself especially, would raise questions about substitution. My understanding was it was something that they were very, aware of, that this could occur, and they were trying to design thoughtful policies around. I also could sense that there was enormous political pressure, right, that they were facing to try to, crack down on e-cigarettes specifically, right? So I could imagine that they were in a tough position, right, where they were, they understood the science, right, but they also were certain political realities that were aggressively pushing e-cigarette regulation.
So, Dr. Pesko, knowing what you know now, with your research and obviously hindsight, what would your recommendations be to tobacco control in Canada?
I think in general, just focus on trying to regulate proportionate to risk, right? Try to avoid kind of, fear mongering about new products, that kind of thing. Try to just figure out, okay, what do we believe the risks of these products to actually be, right? I mean, e-cigarettes are one thing, right? You're still like inhaling, nicotine into, and some other things into the lungs, right? I mean, I think that, there's a reasonable argument to be made that these are probably still more dangerous than something like nicotine pouches, right? That don't even have tobacco, like in many cases, right? Just nicotine extracted from tobacco, right? So I mean, the point is figure out what the risk is. So you got a cigarette, 100% risk, right? E-cigarettes, maybe between 5 to 33% the risk. Nicotine pouches, probably even way lower than 5%, right? And just kind of avoid the temptation to get really, emotional about new products, right? Try to objectively look at what the risks are of these products, and just because some kids are using it isn't necessarily a bad outcome if it means that they're using these products instead of more harmful tobacco products, right? And if you want to regulate, after identifying what the risks are, set the regulation proportionate to that risk level. And that's easy to do for something like taxation, right? In which you have a nice continuous, number. So you can get 33% of $1 tax, right? 33 cents. It's a little harder to think about in terms of minimum legal purchase age laws, in terms of flavor restrictions, right? But there could be ways to do that, right? Like maybe allow some flavors in e-cigarettes, right, that are not available in combustible tobacco, and even more flavors in pouches, for example, right? Like that might be a way to regulate proportionate to risk within those domains.